something that you need a physician order for. Your units might have standing orders that for straight capping, or your patients might have some standing orders, but you have to have an order for a full insertion. So you know you need an order, you've introduced yourself to the patient, you've washed your hands, you've gathered your supplies, you've gathered your assistant, and you are ready to insert the catheter. Okay, so what's the first step on your checklist?
Position and dorsal recumbent position.
Okay, so I have to get the position in the right, the patient in the right position to insert the catheter. I do some of my prep work first, so the patient isn't sitting in the, wide open position waiting for me to get done with my setup. So I wait to get her in that position until I'm ready to do so. But I would have already introduced myself, told her what I'm going to do. I'm going to put her head of the bed flat. And this is when you guys start thinking about yourself and your lower back and your ergonomics. And so I'm actually going to raise, not her feet, I'm going to raise the whole bed up to my work level. She's blinking at me.
Look over here.
Use your focal point while I do the catheter. Okay, so I'm going to move the bed up to my work level. So when I said gather my supplies, what do I need?
Tray and sterilize.
So I need a catheter kit tray. Now this one has the Foley bag in it, the bag that we're going to, the catheter bag that we're going to take to the bedside. Some just have the catheter, the catheter, the Foley catheter itself. And so make sure that you have all the supplies that you need. The sterile gloves will be in here. And so I have my clean gloves if I need to do pericare first before I sterilize and clean the area. I would have got maybe a graduate if I want to empty her fully right away, which probably wouldn't be the case. Or I might have gotten a cup for a urine sample, which actually they might be in here as well too. I would get somebody to help you. It's kind of a skill you need it's really nice to have an extra pair of hands. Sometimes you need a flashlight. Sometimes you can use the overhead light if you're in a room that has one. You really need that extra pair of hands because a lot of the patients you're going to put a catheter in are not young and healthy adults that can get into these positions very comfortably. You're going to be dealing with an older person maybe who needs, Chris can be talking her through it, who can help me hold legs, and definitely with your obese patient, a female obese patient is one of the hardest catheter insertions you'll do. It is very difficult to find that location, and it's very difficult to get there, and literally Chris is going to hold legs, and you're going to hold bellies, and you're going to hold labia, and so you really do need another pair of hands to insert a catheter. The only catheter insertion we're going to test out on is a female. It's the more difficult catheter insertion. We do have a male mannequin, and we'll demonstrate it quickly, but you will test out on a female catheter insertion. Okay? All right, so what's step 2?
Open setup using aseptic technique.
Okay, so I'm going to open my setup, and the other thing I like to have right here, which I don't have in my area, is a garbage.
Yep.
There's one right here. And because step 1 did say get her in the position, I'm going to go ahead and start getting her in the position because I'm going to put a pillow underneath her, a towel underneath her eventually. So, of course, I'm telling the patient what we do. It's something you can't really maintain her privacy when you're putting in a catheter, but I could make sure the curtain was closed if she had a roommate. I'm going to put her legs back down because I really didn't. Put that over there so they can see. And I'm just going to, I would leave these on her bed, but I'm just going to move them completely out of the way so you can see a little bit better.
You'll also see some older nurses do this thing where they take that blanket, they make it into a triangle, and then they actually drape the legs for a little bit of extra privacy. But for demonstration purposes, I want you guys to be able to see.
Okay, so when I'm ready to get her in the position, I'm going to pull her gown up. I'm going to lift up her knees, have her help me. These mannequins are really hard to move.
They don't bend very well, do they?
And then you're going to pull them off to the side. They don't bend very well, but I think you get the point. So you're going to kind of frog leg position, pull her legs up, lift them out to the side. So right now this would be good enough until I got to the point where I'm ready to actually touch her. So I'm going to open my kit here. Okay, can I touch this? It's sterile in here. Okay, why can I touch it? It's the outside, yep. So I'm going to throw my things away, drop them on the floor, do what you need to, get them out of the way. And then I'm going to turn it this way. And I'm going to open this away from me and see how I'm not up and over the top. I'm going to do and now I have my sterile field ready. And where can I not touch? What if I go like this?
No, that's it.
Contaminated my field. Cannot touch anywhere on here. Okay, so if you have, this is why you need your full tray table open. You get rid of their stuff. This is your workspace, not their collection for all of their belongings. So it's open and ready. So now, how can I grab these sterile gloves? And how am I going to grab them, and what am I going to do with them? I'm kind of grab them by a corner here, and I'm going to move them where? Over here. Yep. What's the next step? Are we on that next step yet?
Just
Don
sterile
sterile
gloves.
Okay, so how do we don sterile gloves? Has everybody practiced it? Comfortable doing it? Don't have the folding back over your sterile gloves. You've found ways to make sure it's pinched and straight like that, so it doesn't do that. These probably aren't really sterile gloves, so it's hard to get them to stay in positions how we want them to stay. Okay, so I like to take my things and then like step back away from my sterile field, so I'm not contaminating my sterile field at all. Got the edge of my gloves, putting them on. What do I do about that? I can go on the inside, pull it down. These really sterile gloves will fit much better. The ones that you are using probably fit a little better than these ones. Now, can I fix that yet? No. So how do I do this now? Grab these, cuff it, step back away from my sterile field, put my gloves on. Do that. Panic when you're in checkoff. What can you do about it? This
Touch
is sterile, so I can fix my gloves. Okay, so my gloves are on and I'm ready to go. What's my next step?
Lubricate distal 3 inches of catheter.
Okay, so now I'm going to finish setting this up in here. I'm going to grab this towel. I'm going to give it to my little partner here and say, Chris, could you take that? And how do you take, this is important to know that role. How do you grab something from someone who's sterile? Don't touch their gloves. Yep, so he's going to grab this. I'm going to say, keeping someone else. And then he's going to take that and he's going to place it underneath the patient. He's going to grab it out. And what I don't often use these, with all these stuff that comes in here. I would have probably went and got a blue chuck and actually like this one, not really this there, but I would have got a blue chuck to put it under her bottom area. That one's fine to use as well. That one has an up or a down.
There's usually a trend side and trend side goes down the flight area. Which one is this? I can see it. Can you have her those up?
Back here to my sterile area. I'm going to take this line. This is the one that you could use for the nail catheter. It opens up they throw all this stuff away. They don't use a lot. So what does it say? Lubricate the distal. Okay, so I still have to get to that one. So I've got some swabs in here that I need to clean here. So I'm going to cut these off the side. I'm going to take my lubricant. Sometimes it's in the form of a syringe. Sometimes it's in the form of a. I'm going to open it up and I'm going to use gloves that are syringe. So you can actually bring your own set of sterile gloves in. You don't have to use the ones that are in here. But these three are the ones that came in the hospital kit. I would go get the And I have, this hand's dirty now, I bring this hand in, I clean from top to bottom, and then what do? Throw it away. Then grab my next one. She's really hard to not contaminate your hands because her legs are not spread apart, so. I'm gonna do another one probably on the outside of that same area. I wouldn't repeat, throw that away. Grab another one, and I'm gonna wipe from top to bottom on sort of the right side. So I did middle, kind of left side, and then right side. Now she's clean and ready for insertion. What does the next step say?
Grasps catheter with uncontaminated hand.
Okay, so your best, oops, I'm sorry, that was.
Oh, and gently inserts into bladder until urine flows through the tubing.
Best practice, don't move this hand. Just leave it here. You're gonna hold the labia apart. And really, truly, if this was a large person and difficult to find, Chris would probably have clean gloves on and he'd be helping hold parts or hold a light or hold legs